Welcome to your online lecture for Chapter 4, which is entitled Human Body Systems Within Your Text. As a first responder, you must be able to recognize illness and injury and also know how to care for each injury and illness that you might encounter within the field. And so I think it's important that as a first responder that one of the skills that you have is communication skills, right? And so it's important that you'd be able to tell other medical personnel about a patient's problem as quickly and as accurately as possible to ensure that your patient gets timely and also efficient care in an emergent situation. But to do all of this, you really do need a solid foundation of basic knowledge. And so the purpose of this online lecture really will be to allow you to study the anatomy, which is the structure of the body, and also the physiology, which is how the body works. And so during this lecture, you'll be introduced to common anatomical terms. And I believe these anatomical terms will truly allow you to communicate a lot more efficiently with healthcare professionals in an emergency situation. We're going to begin this lecture with talking about different patient positions, and the first referent position that we'll refer to is the anatomical position. And so what is the anatomical position? In this position, your patient's body or your patient will be standing erect. Their arms will be down at their sides with their palms facing forward. Typically their feet are together and their head is also facing forward as well. And so if we were to look at this figure below, what you would see is exactly what I've described. The palms are facing forward, both feet are together, and then you have the head and the eyes that are also in a forward position. And so this is the anatomical position, and it is in this position that we would refer to right and left sides of our patient. And I think it's important to note here that when we refer to a right and a left, that we really are referring to the patient's right and left and not our own. So from the anatomical position, we can talk about body segments or planes of movement within each human being. And so there are really three different planes of movement. The first plane of movement is the sagittal plane. The second is the frontal or coronal plane. And then last but not least, we have the transverse plane. And it's important that we understand that there are three planes or three cardinal planes, because within each of these planes certain movements tend to happen. And so we'll talk about which movement patterns occur within each of these planes. And so within the sagittal plane, you have shoulder flexion and extension occurring, or hip flexion and hip extension occurring, or we could say at the neck flexion and extension. So if we were to move our shoulder forward or bring it back in a straight line, then we would say that this movement is occurring in the sagittal plane. So the next plane of movement is the frontal plane, and the frontal plane is that plane that typically divides the body into anterior and posterior halves. And so movements that typically occur in the frontal plane are going to be abduction and adduction, or abduction and adduction. So we can think about abduction and adduction with a patient who is doing a jumping jack, and so the arms moving away from the body to the top of the head and then coming back to the starting position would be considered to be abduction and adduction. And also in addition to that, when the legs move away from the body and then back towards the body again into abduction and adduction, these are frontal plane movements. So again, the frontal plane would divide the body into posterior and anterior halves. Your sagittal plane, if I did not say that, your sagittal plane is going to break the body up into right and left halves. And then last but not least, we have our transverse plane. Our transverse plane is going to be responsible for, or movements that are going to occur in the transverse plane are going to be rotary in nature. And so what do I mean by that? Well, trunk rotation, hip internal, external rotation. All of these movements are going to occur within the transverse plane of motion. And so the transverse plane, what it's going to do is it's going to bisect the body into superior and inferior halves, right? And so basically another way stated is we're dividing the body into upper and lower halves. And so movements that occur again in the transverse plane are going to be rotary in nature. So during an emergency situation, we can encounter a patient in really 2 or 3 different types of positions. The first position that we'll talk about is the supine position. And the supine position is really defined as a patient that you encounter that is laying in a face-up position, or a patient who is laying on their back. And so we would say supine equals a patient that we encounter who is laying in a face-up position. Ideally, in an emergency situation, this is the position that we want a patient to be in. It allows us to be efficient with our initial assessment it allows us to perform our physical examination of the patient without moving them very much. And so we have the supine position, which is the optimal position. And then when we move from the supine position, another position that we can encounter our patients in is the prone position, right? And the prone position really is defined as a patient that you encounter who is laying face down or is laying on his or her stomach, right? And so again, the prone position equals a patient who's laying in a face down position. Now, this is probably the least ideal position that you want to encounter a patient in. And the major reason is if we have a suspected head injury, it becomes very difficult to log roll that patient over onto their back without getting tons of spinal movement. And we'll talk about this a little bit more during spinal immobilization of a patient who we suspect has a head or a neck injury. But one of the advantages of encountering a patient who is in a prone position is the idea that during the physical examination, we can go ahead and sweep the back for any fractures or any other deformities, open injuries, tenderness, or swelling that they might have before we roll them over into a supine position. But again, the worst position a patient could be in if they do have a head and neck injury. The last position we'll talk about is the lateral recumbent or recovery position. In this position, obviously, as you can see, the patient is lying on either their left and or their right side. And so this is an okay position for a patient to be in. Again, it allows us to sweep their back before we actually put them into a supine position to begin our initial assessment and our physical examination. And then as a first responder, one of the great things about the recovery position in particular is this idea that if we have a patient who is unresponsive, if we have a patient that is unconscious, what this position allows us to do is to leave this patient if we need to go call 911 without worrying if our patient is going to choke on vomit if they were to vomit. And so the advantage is with this position, our patient is on our side, and what we can see is that the arm is being used as a kickstand to prevent the patient from rolling over into a prone position. But most importantly, what we see here is the head. The head is going to be placed in a downward position towards the ground, and what this does is it places the head in a gravity dependent position so that if our patient were to vomit while we were calling 911 or while we were treating another patient, that vomit would then go onto the ground. And because it does that, we have less of a risk of a patient choking while they're unresponsive if they do vomit in the field. So we've talked about patient positioning, and now we know how to communicate the position that our patient is in to an emergency responder for calling 911. Now we kind of have to talk about direction. So in which direction or where exactly is that injury in comparison to what we'll call a reference point or a point of reference. And so the first anatomical directional terms that we'll talk about are proximal and distal. And so when we refer to something that is proximal in nature, what we're basically saying is that injury or that wound is close or near the point of reference, right? And so when we think about proximal, again, we're saying that injury or wound is closer to the point of reference. And then when we say something is distal, what we're really saying is that object, that injury is distant or it's far away from the point of reference, right? So far away from that point of reference. Well, then you might say, well, what's the point of reference? Typically and usually it's your patient's torso or their trunk, right? Or their chest, another way to say it. And so the reference point, we would say in this case, would be the patient's chest. And so anything that would be going towards or near the point of reference would be considered proximal. Anything that is away from the point of reference would be considered something to be distal, right? And then we have our terms of lateral and medial, which to me we're most familiar with because we tend to use these descriptive terms most often. But when we refer to something that is lateral in nature, what we're saying is something that goes away from the midline, right? And so what is the midline? The midline is an imaginary line that we draw that bisects the body into right and left halves evenly. And so again, if we say something's lateral, we're saying it's moving away from the midline. And then if we say something is medial, we would say that it's moving towards the midline. And one example that I have of that, when we think about the ankle joint, you have both a lateral, which is away from the midline, and you have a medial malleolus, right, which is closer to the midline. And then we think about posterior and anterior. We think about something that's posterior. We think of something that's towards the patient's back or the back of the patient. And then when we think about anterior, we think of something that is towards the front of our patient, right? And then last but not least, with superior and inferior, well, how do we kind of describe these terms? So something that's superior really means it's toward or closer to the head. So we would say superior here. And then something that's inferior would be toward or closer to the feet, right? And so when we describe something, when we describe an injury, we really should be using these anatomical directional terms, proximal distal, lateral medial, posterior anterior, and superior inferior, right? And so let's give an example of how to use a specific term. So we would say if a patient has, let's say, a mid-quad strain, we would say that the injury occurred either distal to the trunk, distal to the knee, distal to the tibia, or proximal to the hip, or proximal to the trunk. So we've got to use these anatomical directional terms to describe our patient's pathology or the location of our patient's pathology and or illness. So the organs of the body are located within certain body cavities. As you can see on this figure to the right, that there are several different body cavities that we have within our body. The first body cavity that we have is the cranial cavity, and the cranial cavity, obviously, as the name implies, is really going to house our brain, right? And so if we have a patient who we suspect has some type of injury to the brain itself, then we would say that that injury has occurred to the cranial cavity, right? And so it's another way to communicate to our EMS operator when we're describing our patient's injuries and or wounds. And then our next cavity after the cranial cavity is the spinal cavity. And so again, we have the cranial cavity, which houses the brain, right? And then the spinal cavity really is crucial and an integral part because it houses not only the spinal cord, but also the nerves that are associated with the spinal cord as well. And so we can see that any injury to the spinal cord would occur to the spinal cavity. And so we kind of want to be more descriptive when we're using terms to describe injuries to the spinal cord. After we talk about the spinal cavity, so we talked about the cranial cavity, which houses the brain, talked about the spinal cavity, which houses the spine and all of its nerves and vertebrae. Next would be the thoracic cavity. I think the thoracic cavity plays a huge role in a human's ability to live. The reason being is it's because it's the major protector, right? Remember, the heart lies within the thoracic cavity. And so what we would say is that the thoracic cavity houses not only the heart, but it also houses the diaphragm, which is the muscle of respiration, and also our lungs. So the capability and the ability for us to breathe. And so again, the thoracic cavity also has the anatomical structures known as the ribs, right? And those ribs are responsible for essentially protecting the heart from being injured from a direct blow. So the thoracic cavity, again, contains several different organs. The major organ would be the heart, but it also contains the lungs and the diaphragm, which is the muscle of respiration. Next on this list, we have the abdominal cavity, which is here, and we'll talk about this in more detail on another slide. But overall, the abdominal cavity contains the organs of digestion and excretion, and it also includes the liver, our gallbladder, our spleen, the pancreas, kidneys, stomach, and then the colon, and also the intestines. And so we'll talk about the abdominal cavity a little bit more in detail once we get to that slide. And then last but not least, we have the pelvic cavity. And the pelvic cavity is actually very important because it houses our reproductive organs, right? And we would say that some of us treasure those, and those are kind of jewels to us. But in addition to the reproductive organs in the pelvic cavity, our bladder and our rectum also are anatomical structures that are within the pelvic cavity, right? And so we could say if the bladder's injured, more than likely the EMS operator would know that an injury was sustained to the pelvic cavity itself. All in all, the body's cavities are important to know because they house different organs, internal organs that we need to be aware of. And so we know that if a cavity is injured, we would then have great knowledge of what anatomical structure might also be compromised. So going into more detail about the abdominal abdomen cavity, or the abdominal cavity, we really have to think about the abdomen in terms of being broken up into 4 quadrants. And so it says quadrants. I would actually write a number 4 over this, because the abdominal area, or the abdomen, is divided into 4 quadrants. And these 4 quadrants really are important in terms of systematic palpation of our patient who we suspect has an internal injury. And so we would label these as either upper right quadrant, and then we would also label them as your lower right quadrant here, lower left, and then your upper left quadrant over here. And so what is housed within each of these quadrants? I think it's important to know the major internal organ within each of these quadrants. And so in the upper right quadrant, the liver is housed, okay? In the lower right quadrant, the appendix is the major internal organ. In the upper left, we have the spleen, and in the lower left, we have the colon. And one way that I remember the major organs within each of these quadrants is to think that USC is in LA, so liver, LA, spleen, S, and then colon would be C. And so when we appreciate the abdominal area being broken down into 4 quadrants, it makes us better palpators and touchers, and also evaluators of the abdomen, because we treat the abdomen as 4 segments, and this allows us to get a better basis and to form better judgments in regards to which internal organ might actually be injured. We'll do this in lab as well. So the musculoskeletal system is made up of the skeleton and the muscles, and we'll talk about the musculoskeletal system in 2 segments. The first part is the skeletal system, and the second segment will be the muscular system. So overall, when we're talking about the skeletal system, which is the bony system, it really is the bony framework for the human body. It's responsible for shaping who we are as human beings. We could say that bone is composed of both living cells and non-living matter, and that non-living matter contains calcium compounds that kind of help make our bones hard and rigid, right? So we don't just break down and disintegrate when we get hit by something. And so the adult skeleton, if you don't know this, it's made up of approximately 206 bones total for a human adult, and it must be strong enough to both support and to protect us as human beings, but also to permit motion, and also allow us to be flexible enough to withstand stress. So if we could say, well, what are the 3 or 4 functions of the skeletal system? We would say to support and protect. We would say it's to prevent motion, and it's to allow us to be flexible enough to prevent injury or to withstand stresses on the human body. So again, if we look here, these are truly the functions of the skeletal system, not the muscular skeletal system, just the skeletal system independently. And so as we look at function of the skeletal system, I think it's important to also look at the major areas of the skeleton. And those are going to include the skull, the spinal column, the thorax, the pelvis, and then obviously the shoulder girdle in the upper extremity as well. And so we'll talk about those independently for a few seconds. So our first stop is going to be the skull, and we would say that the skull is a hollow shell that's responsible for housing the brain, right? And so the skull would kind of make up the cranial cavity, right? It is very hollow in nature. It has to be hollow to receive or to make room for the brain. And then we have the spinal column, which we'll talk about more in detail on a separate slide. But the spinal column obviously is very important because it's what's responsible for really allowing us to stand erect, but it's also going to protect our spinal cord, right? And so the spinal column is the central supportive bony structure of the body, and it's going to consist of what we would call 33 bones, which are entitled the vertebrae or the vertebrae, depending on who you ask. And so that's our spinal column itself. We also have the thorax, which is located here centrally, anteriorly, and then also posteriorly we have the thorax. And the thorax, or what some people would say is the rib cage, protects the heart and the lungs and other vital organs of the body, such as the liver and the spleen in the upper right and upper left quadrants. And so the thorax plays a major role in protection of major vital organs. We have 12 pairs of ribs that are attached to the anterior and posterior portion of the spine, which you should have learned in KPE 280 with Dr. Sullivan. And so those 12 pairs of ribs articulate with the spinal column, right? And then they allow us to rotate. They help us function during respiration, which we'll talk about a little bit later. And then moving down the chain, or distal, we would talk about the pelvis. And so the pelvis, when we talk about the pelvis, it's here. It's composed of 3 bones: the ilia, the ischium, and also the pubis. So we would say that the iliac crest form the wings of the pelvis. And so we think about iliac crest, we're talking about these little guys here that kind of look like Mickey Mouse ears in one sense, right? And so these, the pelvis is really important for obviously protecting our reproductive organs, ladies, because we don't have external genitalia. So the pelvis is really important in females more so than in males. But obviously we know that if injury occurs to the pelvis, that it could affect anything within the kinetic chain. And then we have the shoulder girdle, which would be considered to be the glenohumeral joint, right? And so the shoulder girdle really consists of the humerus, which is here, or the long bone that's here, the clavicle, which is here. Some of you guys might call that the collarbone. And then obviously posteriorly, the shoulder girdle is going to consist of the scapulae, or what some people would call the shoulder blades. And the shoulder is important. It's highly movable. It has several different ranges of motion. It allows for flexibility. It's one of the most injured joints within the human body. And then last but not least would be what we would call the lower extremity, which is anything below the spinal column itself, or the lumbar spine. And so what we get is the largest bone in the body, which would be the femur. So we get the largest bone in the body, can withstand tons of stress. We get the free-floating sesamoid bone in the body, which is the patella, most often dislocated or subluxed. We get the tibia, where you tend to see a lot of shin splints and or medial tibial stress syndrome. And then you get the most lateral bone in the lower extremity, which is the fibula, right? And so we'll talk about these more in detail when you take the lower extremity injury evaluation course next semester. So we talked about the skeletal system independently, so we're also going to talk about the muscular system independently as well. The human adult has approximately 640 muscles within the human body, and we would say that that's a whole heck of a lot of muscles within the human body, right? And so what's the function of the muscular system? I really, when we think about it, the major function is to allow us, again, to be erect, just kind of like the skeletal system, right? And that's why the two really work together to allow us to function, to allow us to ambulate, to allow us to stand in an erect position. I think one of the major roles of the muscular system is really that the muscles have the ability to contract, so they can become shorter and thicker, and then when stimulated, they can also elongate as well. And so each muscle, when we think about what it's made up of, is made up of like long thread-like cells called fibers, and these are closely packed and are bundled. And so then you get overlapping bundles, and those bundles typically are covered by connective tissue. So we have independent muscles, and these independent muscles are then grouped like, let's say, a quadriceps muscle group, and that group of muscles is then covered by connective tissues to protect it and to hold it into place. So we'll talk about the different types of basic muscles that you can have within your body a little bit more specifically on the next slide. So what are some problems that could require emergency care in the musculoskeletal system? The number one pathology that you probably would be most concerned with is a fracture, and more specifically a compound fracture where the bone has actually protruded through the skin. Another pathology that could occur to the skeletal system is a dislocation where the bone is moved completely out of its position, and or a subluxation where it moves out and then goes back in. And then we think about injury to a muscle specifically, we would think a strain. So ST strain would be representative of an injury to a muscle. And then we have our ligaments, which are responsible for holding bone to bone. You can also have a sprain to the ligaments. Overall, we really do need to be careful in our assessment of musculoskeletal injuries. At times, especially as clinicians, we tend to maybe overlook injuries because they may not look serious. One of the injuries that I think about is the abdominal injuries, where a patient might be bleeding internally and we may not actually see the discoloration, and our patient starts to rapidly deteriorate without us knowing this. And so do not forget about nerves, blood vessels, and organs when we're doing our initial assessment and our physical examination. Keep in mind that we could always look for dots, right, which is deformity, open injury, tenderness, and swelling, as we're going through our physical assessment and our initial assessment as well. So there are 3 different types of muscles within our body. Again, as I've said, the muscles composed of about 640 muscles, and they're going to make up roughly half of the body weight, which is, I find that to be interesting. And these muscles can be divided into 3 different groups, right? And so we kind of have them listed here on the PowerPoint slide, but the number 1 group would be muscle, which is comprises of most of the muscles within the muscular system. And then you also have your cardiac muscle, and then last but not least, you have your smooth muscle as well. And we'll kind of talk about these independently, but let's talk about the skeletal muscle first. The tissues most commonly thought of as muscle is skeletal muscle, right? So when we think about, or we say someone's muscle, we're really referring to their skeletal muscle. Skeletal muscles cover your skeleton, right? So they're going to cover the bony portion of your human body, and it gives the body its shape, right? They are attached to the skeleton by tendons, and are directly connected to rough patches of bone. And so when we think about skeletal muscle, one thing that we really truly do have to know is that it is a voluntary type of muscle. And so what do I mean by voluntary? What that means is that they're under your control. You consciously control what they do. We would say that just about all body movement, from walking to nodding your head, is caused by some type of skeletal muscle contraction, right? And so the majority of movements that we do or that we perform as human beings really are going to be attributed to the skeletal muscle, right? And again, that it comprises for most of the muscles within the muscular system. However, we do have 2 other types of muscles that we do have to talk about because they are just as important as our skeletal muscle, and that is the cardiac muscle and the smooth muscle. So the next muscle we'll talk about is the cardiac muscle, and obviously the name cardia applies to the heart. And so when we're talking about cardiac muscle, what we're saying is that our heart is made up of cardiac muscle, and this type of muscle only exists in your heart. It isn't anywhere else. And so unlike the other types of muscles, so our smooth muscle and our skeletal muscle, the cardiac muscle never gets tired. We could imagine that if it did get tired, that obviously our heart would stop beating. We wouldn't be getting any blood flow or oxygen to our target tissues, and we would die. And so it's a good thing that our cardiac muscle does not get tired. It works automatically, so it's involuntary, and constantly without ever pausing. And so the only time our heart really pauses is if we're in cardiac arrest, right? Where the heart has stopped beating, and you've stopped breathing. And so cardiac muscle contracts to squeeze blood out of your heart. And then it relaxes, obviously, to allow the ventricles to fill again, to be for the blood to fill with blood to be pumped out to the rest of the body. And so cardiac muscle is probably one of the most important types of muscles we have in our muscular system. We just don't talk about it at all because it seems like it's something that should just occur naturally. So last but not least is the smooth muscle, which is typically found within the walls of your hollow organs. So like your intestines, your stomach, your bladder, and just like the cardiac muscle, your smooth muscle is also going to work automatically. So it's going to be involuntary in nature. So it's going to work automatically without you being aware of them. And so when we think about smooth muscles, let's think about housekeeping functions of the body. And one way we can think about this is the muscular walls of your intestines. Those contract to push food through your body, right? And eventually through the process of digestion, we kind of get rid of any food that wasn't absorbed within the body itself. And that process is an involuntary process, right? The muscles in your bladder will contract to expel urine from your body. Again, that's another type of involuntary process. And then we can think about females, our uterus, or the womb itself will help push the babies out of our body during childbirth. All of these things are really involuntary actions. The smooth muscle contracts, and because of that contraction, we can get some type of forceful movement of the food, the baby, or the urine out of our body. So remember that when we talked about the respiratory system a few weeks ago, we talked about the body being able to get enough nutrition from food to last for several weeks. It can store water for several days, but it can only store oxygen for a few minutes. And so the body obviously depends on a constant supply of oxygen, and that constant supply kind of comes from the act of respiration, right? And so we can think about the respiratory system as really being responsible for delivering oxygen to and from target tissues, and then removing carbon dioxide from the body. And so the passage of air into and out of the lungs is called respiration. So you might say, well, what is the structure and function of the respiratory system? Really, it's to allow us to inhale and to exhale, and to allow oxygen to go through our airway. And we've kind of talked about this already, the process of breathing and how air can go in through both the nasal and oral pharynx, and then down into the pharynx itself, and then into the larynx, trachea, and then obviously it gets distributed to the bronchioles and then into the alveoli, where gaseous exchange occurs. And so this process of air being delivered to the alveoli to be administered to the circulatory system so that it can be delivered to target tissues is the process of respiration. Now, you might say, well, what happens if there's compromise to the respiratory system? Then we might imagine that other human body systems might also be affected as well. So what happens during respiration? Well, the major muscle of respiration is the diaphragm. And so when we think about inspiration, for example, or inhalation, the muscles of the thorax are going to contract. And when the muscles of the thorax contract, the ribs move outward and up. And then the diaphragm contracts and lowers. And so it's during this moment that we're allowed to take a deep breath and bring in oxygen into the body. The opposite of that occurs during expiration or exhalation, where you really have the muscles of the chest relaxing, the ribs moving inward, and then the diaphragm relaxing and moving into an upward position and into its resting position. And so we might see how the diaphragm is the major muscle of breathing. If there's dysfunction within the diaphragm, then our breathing is hindered in some way, shape, or form. So on average, the average adult breathes about 1 pint of air per breath. And another thing to know is that 10 to 20 breaths is within normal limits for adults. And so we might say that anything that falls below 10 breaths per minute would be considered hypoventilation, right? And then on the opposite end of that spectrum, anything above 20 breaths per minute would be considered hyperventilation. And either end of the spectrum really poses a problem for how much oxygen we're getting to the target tissues. If you have someone who isn't breathing fast enough, then you're not getting in enough oxygen. If you have a person who's breathing too fast, it might be that the oxygen isn't reaching the alveolar level. And because it's not reaching the alveolar level, then you still don't get good distribution of oxygen to the target tissue. So we need to know these values so that we know when we assess a patient's breathing in the field what the normative values might be. So the circulatory system and the respiratory system really work together. The major role of the circulatory system is to deliver oxygen, right? That would be delivered from the respiratory system and nutrients to the body's tissues, but it also aids in removing waste products via the bloodstream, and it consists of or is composed of the heart, the blood vessels, and also the blood itself, right? And so when we think about the heart's major role in the circulatory system is truly to pump blood throughout the rest of the body, specifically to the target tissues, right? So that the heart cells, the brain cells, or the muscle tissue does not begin to die off. And so when we think about the blood vessels within the circulatory system, their major role is to deliver either oxygenated blood to the heart or to remove deoxygenated blood from the heart and bring it back so that it can be reoxygenated again. And so the arteries are one of the blood vessels, and the arteries contain oxygen-rich blood or carry oxygen-rich blood away from the heart to the rest of the body. And so we can think about the arteries and say that they're responsible for delivering oxygenated blood to the tissues within the body, right? The capillaries on the opposite end of the spectrum are going to transport blood to all the cells of the body. So they're going to pick up blood from the arteries, transport that blood to the cells of the body, and then last but not least, we have the veins closing the circuit, and they're going to carry oxygen poor blood back to the heart, where it can be reoxygenated and then recirculated via the arteries and down into the capillaries, and then back down into the veins. And so what we can see is that there's this closed circuit where we constantly have oxygenated blood being delivered from the tissues to the tissues, and then you have deoxygenated blood being picked up from the tissues and redelivered to the heart, to where it can be oxygenated again and supply the tissues all over again. And it's this closed loop or closed circuit that allows us to function as human beings. It allows us to get as much oxygen as we might need to sustain life. So what we can see is really this closed circuit of blood flow, where we have the arterial blood flow, which is very oxygenated, right? It's going to the tissues. We have the capillary delivering that oxygenated blood to the cells. And then we have the veins, which are picking up deoxygenated blood and kind of bringing it back to the heart to where it can be oxygenated. And so I kind of really like this animation, because it really shows the flow of oxygenated blood to the rest of the body, and then how the veins pick up that deoxygenated blood and kind of bring it back to the heart to where it can be oxygenated all over again. So part of circulatory assessment really involves the assessment of the patient's pulse. And so there are several different pulse sites that we can check in the emergency field. And so there are at least 7 listed here. What we want to do is we want to assess a pulse that is always distal to the injured site. And the reason that we assess a pulse that is distal to the injured site is it allows us to get an idea of whether or not blood is flowing to the distal extremity, right? And so we think about distal, we're saying something that is away from the point of reference. So we always want to check the most distal pulse that we can to get a true gauge on circulation or blood flow to the extremity. And so when we look at letter A, what we're looking at is the radial pulse. The radial pulse is always checked on the thumb side of the patient's hand. And we always want to check a pulse with our first or our second and third fingers. And the reason we do this and not with our thumb is because our thumb actually has a pulse in it. And so we never want to check a patient's pulse with a thumb, because we could get a false positive. In letter B, we have the brachial pulse being assessed, and the brachial pulse is located just in the mid belly of the brachium, or right underneath the biceps on the medial towards the midline portion of the upper arm. We have the carotid pulse, which is the pulse that is most commonly checked in the field. And if you find the patient's Adam's apple and move just lateral and superior, you'll fall onto the patient's Adam's apple, or the patient's carotid pulse. And this is probably the easiest pulse to assess in the field, specifically in an unconscious patient. We have the iliac pulse assessment, which is a rare pulse that we as first responders would utilize, but you still need to know it. We have a popliteal pulse, which is in the posterior aspect of the knee. So this can look deceiving, but it's actually on the back side of the knee. And we really want to check the popliteal pulse in patients with knee injuries, hip injuries, thigh injuries, where we have the pulse that is most distal to the injured site. We also have the posterior tibial pulse, so that you can tell that this individual's hand is on the medial malleolus of the patient, just posterior to it, and you can get a good pulse assessment there. Typically, we check the posterior tibial pulse when we are assessing like a tib-fib fracture, when we are assessing some type of compromise to the lower limb, such as like an anterior compartment syndrome. And then last but not least, we can also check the dorsal pedal pulse, which is located in between digits 1 and 2. The only problem with this pulse sometimes is that it's very difficult to pick up, because it's very, very light and very, very tready. And so we tend to, in the lower extremity, refer to the posterior tibial pulse before we refer to the dorsal pedal pulse. So again, all in all, 7 pulses. Most common pulse is the carotid pulse, and then in a child or an infant, the most common pulse would be the brachial pulse. Now, obviously, we want to check the pulse that's most distal to our injury, and so we would say that it depends. The pulse check is really going to depend on the extent of the patient's injury and the location of the patient's injury as well. So moving on to the nervous system, it's composed of the brain, the spinal cord, and also the nerves that emanate from the spinal cord itself. It's really responsible for coordinating the body's responses to stimuli, and it keeps the body system, so all of the human body systems working together. So we could say the respiratory system, the muscular system, the skeletal system, the circulatory system, all of these systems really function around the nervous system. It is probably one of the most delicate human body systems within the human body. The nervous system is comprised of two main parts. The first main part is what we would call the central nervous system, or the CNS, and then the second portion, or the other main part, is the peripheral nervous system, or the PNS. And so we think about functions again of the nervous system. We would say that the major functions of the nervous system are as follows: to allow the patient to know or be aware of and to react to environments, or we could say environmental awareness, but it's also going to be the glue that kind of allows the other human body systems to function as one entity. So this diagram here would be a representation of, or your representation of your peripheral nervous system. And remember, I said that your peripheral nervous system is responsible for housing the nerves, right? And so when we look at the figure 2 to the right, what we see are the major nerves of both the shoulder, which Dr. Sullivan would call the brachial plexus. And then in the lower extremity, we have the nerves supplying the lower extremity, which would be the lumbar plexus, right? And so overall, what we're saying is that the PNS is really, truly responsible for really relaying information to the other body systems so that they can function appropriately. They are also, the PNS is also responsible for eliciting feedback to the patient or a human being to allow us to respond to different changes within the environment itself. So overall, the nervous system is one of the most complex and delicate human body systems that we have. As humans, it relays information from the body to the brain about environmental changes. It's responsible for activating, coordinating, and controlling the activity of all of the human body systems. Okay, so compromise to the nervous system will definitely lead to deterioration of multiple body systems. And so when we have a patient with some type of nervous system compromise, we have to assess all of the other human body systems as well. And so what's the structure and function? Really, the major structure of the nervous system is the brain. The brain is the center of the nervous system. It's housed in the cranial cavity, and it is the master organ. When we have damage to the brain, we have compromise to the respiratory system, the circulatory system as well, and eventually our muscular skeletal system will shut down because muscle tissues are no longer receiving oxygen. So we can see how the nervous system is probably the most important and crucial human body system within our patients. So the brain has three functions, and we'll kind of talk about the first function first, which is really sensory integration, which is going to deal with how the brain processes sensory input from multiple sensory modalities. And so the 5 most classic senses that we could think of would be like our vision, sight, right, audition or hearing, tactile stimulation and or touch, olfaction, which would be smell, and then obviously gustation, which would also be taste, right? And so we know these as vision, or sight, hearing, touch, smell, and taste, right? Our 5 normal senses. And so we think about the brain's function. First of all, it's to interpret what we're putting in our mouth, to interpret what we might be seeing or hearing, and or touching. And so that's one of the major roles or function is sensory. The second function of the brain is a motor component. And so when we think about motor, we're going to think about movement in a sense. And so really this part of the brain is responsible for telling our muscles to contract. It's responsible for telling our eyes to blink, or for telling our hands to move and our shoulders to flex. And so we think about motor, we think about this portion of the brain being responsible for allowing us to move, for communicating to the musculoskeletal system to tell our muscles to contract so that we might actually make, like, let's say, a bulging biceps, for one example. So when we think about motor, we're thinking about movement. And last but not least, your brain also has an integrated function where you kind of have the integration of both sensory and motor. And so the 4 most common integrated motions or movements or things that we as human beings do is just being conscious and thinking and being aware, being able to remember certain things, our emotions, and then last but not least, our language, right? So we obviously in the United States, we tend to speak English, or at least within our particular campus. However, individuals who speak Spanish or French, etc., this is an integrated component, and it's one of the brain's functions, right? It allows us to be able to put this this language imprint in our brain and to be able to speak multiple languages. And so 3 functions, again, it's sensory, there's motor, and then there's integrated, where we combine both sensory and motor functions to do more complex tasks. So then in moving to the spinal cord and or the central portion, or the central nervous system portion of the nervous system, we would say that the spinal cord plays a huge role, right, in terms of us as human beings being able to stand up erect, and for providing us with a skeleton, right? And so why is the spinal cord important? But well, obviously, if we have compromise and or injury to the spinal cord, our patient could be paralyzed, right? And so the spinal cord becomes really an important anatomical structure. And what we know about the spinal cord itself is that the nerve cells are covered by a membrane, and it's done to protect the nerve cells from damage, because if those nerve cells start to die off, we could have patients who manifest with weakness, and or patients that are actually paralyzed, whether that be paraplegic and or quadriplegic, right? And so the spinal cord goes all the way from the brain superiorly down to the lower portion of the body, which would be the coccyx here. And so when we think about the spinal cord, we kind of have to own it a little bit. It consists of really 4 different segments, and we'll talk about those 4 different segments very briefly. And so the first segment of the spinal cord would be the cervical spine, or as some people would call it, the C-spine. And the C-spine consists of 7 vertebrae. And so we got the C-spine, and we got 7 vertebrae. We got the thoracic spine, which makes up the bulk of the thoracic cavity. And so some people call this the T-spine, so thoracic spine, and there are 12 vertebrae within this spine. We have the lumbar spine, which is, some people would say, is responsible for causing or contributing to low back pain, and so we would call that the L spine. And then last but not least, we have the S spine, or the sacral spine, right? And this is kind of like, oh, I bruised my tailbone. Well, you're really bruising the coccyx portion of your sacrum, and so we've got the S spine. Within the lumbar spine, we have 5 spinous processes or vertebrae, and then in the S spine, we have 5 for the most part. These are the major spines that we'll refer to. So the C spine, the T spine, and the L spine. And again, there's 7, 12, and 5. And how do I remember how many vertebrae are within each of these spines? Well, simple: breakfast, lunch, and dinner. So moving into a new human body system, the digestive system, it is composed of the following internal organs. So the stomach, the pancreas, the liver, gallbladder, small intestine, and the large intestine. So we can kind of see all of these internal organs on this figure right here. And they're really important in really breaking down food and allowing us to digest it in some form, way, shape, or form. We're going to talk about the structure and the function of the digestive system on the next slide. And so when we think about the digestive system, one of the most important functions of the digestive system, in my mind, is really to break down food. And when we break down this food, what the digestive system allows us to do really is to absorb the nutrients that are in the foods that we are eating, and then anything else that is in excess would be kind of eliminated and excreted from the body, right? And so how does this process work? Well, the process works by chewing, right? The process of mastication and breaking down our food. So some problems that could occur in the emergency field as it relates to the digestive system. Some of the organs are not protected in the digestive system, specifically the ones that are in the abdominal cavity that are not protected by the thoracic spine. And so what we most commonly see in terms of the digestive system and injury are really injuries that have occurred by either a stab and or a gunshot wound. And then we also get the internal bleeding that might occur, right? So we get a laceration of a pancreas. We get the laceration of any other organ that might be housed in the digestive system, such as the intestine and or the liver. And so we really need to be aware of, and what we really need to be thinking about is truly how to identify these individuals with these pathologies, digestive system pathologies, specifically those patients who are bleeding internally and we can't recognize or do not see their signs and their symptoms. So we kind of talked about the digestive system. We said it has two major functions: ingestion of food, and then getting rid of any waste that is not absorbed or utilized as a nutrient. And so when we think about digestion in general, we kind of have to think about what does that consist of. And so it consists of two main processes, and those two main processes are mechanical and chemical in nature. And so let's talk about the mechanical process first. When we think about the mechanical process, obviously we think about chewing, swallowing, and then the rhythmic movement of matter through the gastrointestinal tract and the esophagus, and then last but not least, which would be defecation, and that would be basically the elimination of any waste, right? And then last but not least, we have the chemical component. And the chemical component is just the process of breaking down food into simple components so that they can be absorbed and used by the body. And so we kind of think about like eating bread or a carbohydrate that gets broken down into simple and complex sugars that can be then utilized for the body for energy. And so the chemical process is just the process of breaking food down so that it can be used, so that it's simplistic enough to be utilized and absorbed throughout the body. Again, another human body system that plays an integral role in our ability to function as human beings, and we can see that compromise to the digestive system again could lead to deterioration of other systems within the human body system itself. So this figure represents the integumentary system, or as some people might call it, the skin for layman's terms. And so when we think about the integumentary system, what we're really thinking about is the skin and how that kind of protects us from the outside world in essence. And so we have the outermost portion of the skin, or the outermost layer of the skin, which is the epidermis. And so this would represent this thick sheath here. And then we get the next layer of the skin, which is the dermis. And then that is the second layer of the skin. And it's the thickest layer of the skin, or the layers of the skin, as it relates to the other four layers. And so the dermis, or the second layer of the skin, contains a vast network of blood vessels, hair follicles, which you can kind of see on this particular figure, sweat and oil glands, and some sensory nerves as well. And then just below the skin, we kind of get, your fatty tissue or your adipose tissue. Here, you tend to get some of your blood vessels and mainly your adipose tissue, which is kind of going to vary in thickness. And so when we think about the layers of the skin, we get your epidermis, we get the dermis layer, we get the subcutaneous tissue and some adipose tissue that lies underneath it as well, or subcutaneous / fatty tissue. Within the dermis, obviously it houses the major players. Again, like we've said, it's going to house your nerves, which you can kind of see here in this blue and red network. Some of your sebaceous or oil glands are going to be housed there as well. And then obviously in the epidermis layer, we get some of the hair or the hair follicles itself. And those are all important, and we'll talk about those independently. So the integumentary system is composed of the skin, hair, and nails. More specifically, the skin is, again, like I said, it's going to separate the human body from the outside world, but it's also going to help protect the deep tissues from injury. It's going to keep fluids in, which essentially basically prevents us from drying out, or from our skin from being dried out. It's also going to protect us from infection, because it's basically going to prevent the invasion of a bacteria and other foreign bodies from entering our system. And so the skin really plays a major protective role for us as human beings. It does store minerals, and it also makes vitamin D, which are all both protective in the prevention of exposure to UV rays, and it also reduces the risk of cancer development in individuals who are exposed to the sun for long periods of time. So when we think about the skin, we kind of have to think about four major players within the skin. One of those is going to be your hair roots. Your second is going to be the sweat glands. Third would be oil glands, and then fourth would be the most outer layer, which is really a dead layer of cells that are that lay on the skin and protect the skin from invading pathogens should you be exposed to them. And so, what role do each of these four components play within to protect us from invading pathogens? Well, we can think about the hair roots, and the hair roots are important because they kind of keep us warm. And so when we have an extreme amount of hair on the skin, we'd say that you tend to keep in heat or to retain heat a little bit more effectively and efficiently. And then with our sweat glands, the major role of the sweat glands is really to help regulate body temperature. When we get overheated or when we have an increase in body temperature, those sweat glands kind of vasodilate and allow us to release heat from the body so that we can restore a normative core temperature. We get our oil glands, which are responsible for really keeping your skin soft, and in some cases waterproof. And then last but not least, the outer layer, which consists of dead skin. So every time we get in the shower and we scrub our arms and our legs, what we're doing is really scrubbing away that dead layer of cells for the day. And then those cells again begin to proliferate to form another protective layer for the next day. So if you've ever looked at your towel after you've gotten out of the shower or after you've washed your skin, you can see sometimes that your skin actually comes off on the towel, and that's that dead layer of cells that you are washing away. So what's the role of the skin? Again, it's to protect the body from invading pathogens, specifically foreign pathogens, so that they don't get into the body and wreak havoc, either cause illness and or an injury. In an emergency situation, the skin's appearance can really tell us a lot about the patient, and not only about the patient, but the patient's status, right, in terms of their injury and or illness. Patients can present with either a reddened appearance, they could be warm to touch, or they could present with a bluish appearance, pale, or they could be ashen and or cool. If someone presents with a reddened appearance, we tend to assume that their blood vessels are dilated, that they've had this influx or increase in blood flow to that area. And then on the opposite end of that spectrum, if a patient presents to us with a bluish cyanotic appearance or a pale appearance, then we can kind of say that maybe their blood vessels have vasoconstricted, specifically if we're dealing with patients in a cold environment. But when we have vasoconstriction of the blood vessels, we get less blood flow to the injured area or to the area itself. And so when that happens, the area tends to start to get blue and or pale because we're not getting enough oxygen to the target tissues. And so skin appearance can tell us a lot about a patient's pathology and or illness and injury. So these figures represent the urinary system, and so when we think about the urinary system, we have to think about its structure and its function, just like we have with any other human body system. And so the urinary system's major role is really to help the body maintain the delicate balance between water and chemicals needed for survival. And so we can obviously see some of the major structures within the urinary system just within this particular figure below. And the major structures would be the kidneys, the bladder, the ureter, and the urethra, all which are responsible for really filling with urine, and then allowing us to contract and then to excrete that urine or those chemicals from the body. So again, structures, we'd say the bladder is a major player, the ureter, the urethra, and the kidneys as well. So some problems that we might encounter that might require emergency care in the emergency field would be a blow to the lower back. A lot of times in high school football, we get the linemen who are hitting the receivers with their helmet in the lower back, and the major concern would be the kidneys because they do sit a little bit low and they are a little unprotected by the rib cage in the posterior portion of the thoracic cavity. And then obviously injuries to the external genitalia because there's lots of nerves and blood supply, and it's very, very, very painful. In lab, I will show you a way to reduce pain in our male population who may have received a blow to the external genitalia. So the genital ureteral system or urinary system is comprised of obviously the reproductive system and the urinary system. And so when we think about the urinary system, the major role is to eliminate waste products filtered by the blood from the body. And they do that through the process of excretion. Typically that's urination. And the urinary system in particular is going to consist of, like we said, the kidneys and the bladder, and then the ureter and the urethra. The kidneys, again, they're unprotected in the posterior aspect of the thoracic cavity. They extend from thoracic spine number 12, which is the last rib, and then all the way into the lumbar spine at L3. And they're about 11 centimeters in length, and their major function is to filter waste from the circulating blood and to form urine. And so when the kidneys become compromised, we lose the ability to filter out waste, and we lose the ability to form urine so that it can be excreted through the bladder. And then the bladder's major role, it's a muscular sac. It's going to stretch as filled, and then when it reaches its maximum capacity, it's going to contract, and it's going to cause the excretion of urine from the body and or what we would consider to be waste, right? And so the system is really balanced. The kidneys, if they're functioning correctly, again, they filter waste, they form urine. That urine gets delivered from the ureter to the urethra, in which case the bladder gets stimulated, it contracts, and we have excretion of urine from the body. As stated earlier, part of the genital urinary system is also the reproductive system. And so what we can kind of see in this figure is a representation of the female and the male genitalia. Obviously, males, your genitalia is more exterior. You get more blood supply and blood vessels. Therefore, blows to the external genitalia are going to be a lot more painful. And then on females, our genitalia is internal in nature, and so we're more protected. So external injuries to the reproductive system for the female are relatively rare within the emergency medical field. So as we can tell with the genital urinary system, there are definitely differences between the female and the male reproductive system. And again, those differences really are manifested in whether or not the genitalia is external or internal. For the male, it's going to be located on the outside, or externally. For the female, it's going to be internal in nature, because we are protected by our wider hips, our wider pelvic bones. And then the reproductive system as a whole is, we would consider that to be the organs of sexual reproduction. And so I'd like to conclude this lecture by just saying that when we think about human body systems, we really truly do have to think about them as being one unit. So we could kind of say that what we know is that no one body system is going to work independently, that if there's a deterioration to one human body system, that eventually we could expect that other body systems would start to fail if we don't care for the body system that is currently going down. And so again, it's important to just note that when we think about human body systems, none of them work by themselves. They depend on each other. They are codependent on one another to function properly. I think the most important take-home message from this online lecture is really that the more body systems that are injured, the higher the severity of the injury in an emergency situation. So as a first responder, you must do your initial assessment, you must do your physical examination, and you have to determine the number of body systems that are injured, because it really is going to determine how severe of an emergency medical patient you have, and it's also going to allow you to communicate better and more efficiently with the emergency medical services 911 operator. This is the end of your online lecture for Chapter 4. I'll see you in class tomorrow.